Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning, everyone. This is Bryce Patton here for the Senior Moment Show. I'm accompanied by Sid Roeder. How are you, Sid?
I'm good. How about you, Bryce? It's good to see you.
I'm excellent. Thanks. I'm excited for our guest today. We actually have the CEO of Cache Valley Hospital, and he's brought some people, and we'll get into their introductions here in a second. But first, let's hear from our sponsors.
Absolutely. Our sponsor is the Empowering Seniors Group, which is a group of professionals that has dedicated their time and effort to provide information to seniors, their family members, and really anybody who cares. And if you'd like to learn more about the Empowering Seniors Group, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. And lastly, if you have any suggestions for this show, any guests you would like to see us invite, you can call me personally at 435-512-6406.
Awesome. Thanks, Sid. All right. Let's get started here. We have Blake Rose, the CEO of the Cache Valley Hospital, and he's brought some people. How you doing, Blake?
Doing great.
Good. Hey, well, why don't you tell us a little bit about the hospital and who you've brought with you today?
Yeah, no, first I want to just say thanks for inviting us. I know I've been talking to Bryce a little bit of time and now meeting Sid here. We're really grateful to come talk about the things we're doing at the hospital, and there's really a lot of great work, and we're actually really passionate about serving the aging population. In fact, I just have to add one caveat to my personal career. I worked at the University of Utah for several years, and one of my specific roles there was actually working with the aging population in different environments, and so this is a population I think all of us who are sitting around the table today are really passionate about, and making sure that everyone receives the care that they need. And so we're just grateful to be here to talk about that. And so we have actually a few people here. We have Sherry from our wound care clinic. We have Alicia, who does mammography. And we have Chandler, who's from our physical therapy clinic, all here to talk about some different things that I think are actually really important to health and well-being, specifically for the aging population.
Oh, that's awesome. So you guys have a wide variety of things that you do.
Yeah, we have a ton that we do. So a lot of things, it's kind of funny, you know, I grew up just up the road in Idle Falls and came to Logan many times over the years, but we've just moved here about a year ago, and many people still think of us as the specialty hospital, and I still consider us special, which is a good thing because we are special, but we actually do a lot more than specialty care now. We still do surgery, which is super important, but we also do everything else. We have an ER with really short wait times and board-certified emergency medicine physicians and great nurses and staff. We have wound care, like I mentioned. We have a full imaging suite, which includes mammography, great physical therapy, and we even offer family medicine services down at Providence Family Medicine in Providence. Another fun thing is we have a great labor and delivery unit, women's unit. We do inpatient care. There's a lot going on at our hospital. And so, like I said, we are special, but we're more than specialty care.
So that raises the question, is there anything that you don't do? Maybe that's the easier question.
Yeah, there's still a few things and some of the highly specialized things, but most of the things we do take care of in the Valley. On occasion, there's some things, you know, that patients do need to travel for care, but our goal is to actually continue advancing and bringing in additional services, because one of our goals is we don't want people to have to leave the Valley to receive care. So we're always looking at options to keep people here in the Valley.
Oh, that's fantastic. Yeah, I know. I think there's always something that you have to leave the Valley for and go someplace bigger. But, well, awesome. Well, Sherry, I want to ask you, like, what's your role there at the wound clinic, taking care of people's wounds?
So I am the manager of the wound care clinic. And like Blake, my entire career has been focused on the adult gerontology population, and I am very passionate about wound care. So we know that as people age, their skin changes. They have different diseases and health processes that can contribute to wounds. So anytime anybody has a wound that is hasn't changed in a couple weeks, we offer advanced wound care. We have a lot of things that, in fact, most things that we have there or do there is not available to, or primary care physicians do not know about them, or, you know, we're just highly specialized. So you don't need a referral to come to our clinic. Anybody who has swelling in their legs or any kind of sore that hasn't healed, we help manage those health issues that contribute to wounds, such as diabetes or blood flow issues. And our medical director is Dr. Scott Grover, and he's fantastic. He is certified in wound care. He's a surgeon. He does vascular things, and so...
Sherry, I've got a question. So if someone has a wound, what's a time frame like, hey, I don't think this is getting bigger or better, it's actually getting bigger, like what the symptoms do they need to look for to come in and have a chat with you guys?
Yeah, so I would say if you haven't had any changes, it doesn't look like it's getting better within 2 weeks, we really want to see you. If you have any issues such as swelling or weeping, even without wounds, we would want to see you. If you have any redness, pain, increased pain, swelling, any signs of infection, you would need to come in and see us.
Okay. Are there any other things like diabetes or things like that need to be a little more cautious with their wounds? Yeah,
absolutely. Diabetics in particular really need to focus on their feet. Sometimes you lose feeling in your feet and you lose that protective sensation. So sometimes you don't even know you have a wound, or maybe you stepped on something. So daily foot checks are really important for diabetics. And then also as people age, there's changes in the skin. So you're prone to skin tears, prone to just openings in your skin because it's more fragile.
So let me ask one quick question there. Do you also provide some kind of service if people can't leave their home? Do you make house calls at all, or is it only in hospital?
We don't make house calls, but we do a lot of case management at our clinic. So if you come in, then we can set you up with resources in the valley that we can get you the care that you need. So.
Oh, that's fantastic. Well, good. So you're just the one, if they have questions or anything, can they just call the clinic and ask you, or?
Absolutely. Our phone number is 435-713-1350, and you can give us a call anytime and we can help you get what you need.
Oh, that's awesome.
And Sherry, because we're coming up on our first break here, maybe somebody who hasn't been in the Valley for a long time, would you also mention your physical location, please?
Yeah, it's 2380 North, 400 East. It's right next to...
Greenville Elementary.
Yeah, thanks. Greenville Elementary.
Perfect. And can I have that phone number one more time?
Yeah, the wound clinic specifically is 435-713-1350.
Perfect. Well, this is the Senior Moments Show. Again, let me mention our sponsor really quick, which is the Empowering Seniors Group. If you'd like to learn more about the Empowering Seniors, you can do so online at empoweringseniors.info, or you can email us at empoweringseniors.cv@gmail.com, and the CV stands for Cache Valley. And lastly, again, if you have any suggestions for our shows for me, Bryson, or Bruce, you can call me personally at 435-512-6406. This is the Senior Moments Show. We're going to take a short break. Stay tuned. We'll be right back.
This is Mark Thurston with White Pine Funeral Services. The best time to plan is when you have time to plan. Having a prearranged funeral gives peace of mind for everyone involved. White Pine will customize your final wishes to fit your needs, from a traditional burial to cremation to a custom headstone. White Pine also accepts prearranged plans from other mortuaries, and we will absorb any transfer or revocation fees. No penalty to you. Visit whitepinefunerals.com or come and see us for more information.
White Pine Funeral Services, here when you need us most.
Hi, this is Bruce with Comfort Care. One of the ways we help loved ones stay in their home is by assisting with daily tasks. These may include bathing, meal preparation, medication reminders, and housekeeping. We even help with shopping, transportation, and errands. Most of all, we offer a trusted level of care. Let us help you live your best life possible with Comfort Care. This is Bruce, and you can call me at 754-7676. Comfort Care, 754-7676.
Did you know 1 in 3 people will visit a nursing home? Did you know that once there, they will stay there for an average of 3 years? Did you also know there are insurance options that can help cover this experience? Hi, I'm Tracy Ferris with Blue Water Health Insurance. It's not cheap to stay in a full-fledged nursing home. Long-term care insurance can help you or a loved one get the care they need and deserve. If you wait until you need it, you may be too late. Give me a call at 435-890-8155.
It's tough knowing how to care for an aging parent. Mom has always been there for me, but now I need to be there for her. When we found out she needed surgery, I wondered how I could attend to her needs and still be mom to my kids. I was so relieved to learn about transitional rehab at Maple Springs in North Logan. From the nurses to the physical therapists, it was like their whole staff was focused on helping Mom get better. Maple Springs in North Logan was an answer to my prayers.
Learn more at maplespringsnorthlogan.com or call 753-9400.
Welcome back to our Senior Moment Show. This morning we are joined, if you missed the first section, with Blake Rose, the CEO of the Cache Valley Hospital, and some of his awesome staff. We've just heard from Sherry Fernie over at she's the nurse manager over at the wound clinic. But Blake, you guys have some pretty awesome things. You're not just the specialty hospital anymore, but you guys have some pretty special things. Your imaging center, I'm pretty curious about that. Tell me about that.
Yeah, so I just wanted to start and just talk a little bit about imaging in general before we go to Alicia, who's our technician who does mammograms here at the hospital. But our imaging suite, we do full suite. We have MRI, CAT scan, X-ray, ultrasound, and mammography, where we get mammograms done. And in fact, we're just starting a new service this next week. It does require a physician referral if it was ever needed. Hopefully no one would need it, but if they did, we'll have a nuke medicine camera. You can't even ask me, Bryce, what that means because I'm not that smart. But it's a new service we'll be offering that will help patients out, specifically some cardiac needs and some other things. And so we're excited to offer that service as well. The other piece that I'm excited about introducing Alicia on is, you know, as in health in general as humans, we always need to be mindful of cancer, right? I think we probably all know someone in our families who's suffered from a cancer diagnosis at some point, whether it's a skin cancer, it's a breast cancer, it's ovarian cancer, like my own mom suffered from. So it's something we all need to be mindful about, right? And so one of the things that's great about this month in particular is it's Breast Cancer Awareness Month. And so Alicia's been doing a lot of work over the last month, thinking pink, as we all do during the month of October, and leading us into mammogram and breast health. And so that's one of the things I just want to encourage everyone who's listening is to be mindful of their health and take the time to go schedule those screenings. They're super important for not just the short-term but long-term health of you and also your family. And also think about other things, and not so much fun things. We do have physicians at our facility who do colonoscopies. I know that's not the funnest thing to think about, but they're really important for health, right? And so these are things we really do need to think about. And getting a mammogram done, going and seeing someone like Alicia is going to be really important to everyone's health.
That's awesome. Hey, real quick, are those services covered by insurance? Yep,
they are covered by insurance. We also have a pretty significant cash pay program at our hospital where we do cash pay discounts as well, but we do take insurance. So, yep, you just call us. And if you have questions about cost, we actually have a specific staff person who can get you a quote right over the phone, tell you exactly what your out-of-pocket would look like.
Oh, that's awesome. All right, Alicia, I'm a man. I've never had to deal with this. You want to tell me what kind of goes into a mammogram?
Yeah. A mammogram is an X-ray image of your breast, and it is used by a radiologist, who's a doctor who looks at that, to detect any breast organ abnormalities and find cancers if you have them. So the recommendation right now for people having mammograms is every woman should have a mammogram between the age of 35 and 40. That will be their first one. We call it a baseline. And then every year after you turn 40, you should have a mammogram, and you should not stop getting mammograms unless you are unhealthy or unable to come get one.
Okay. Easy enough.
And maybe I need to throw in here too, Bryce, and threw that out, but men can have breast cancer too, correct?
Yes, men can have breast cancer. We don't do preventative screenings for men, but if a man has an abnormality with his breast, he can talk to his healthcare provider and get an order, and we will do their mammogram as well.
Oh, wow. So do you need a referral for this once a year, or is this part of your yearly physical for ladies that do this?
Yeah, you do not need a referral or a doctor's order to have a mammogram, but we do request that you have a healthcare provider that we can send the results to afterwards so that somebody can follow up with your care.
Oh, okay. So it's just once someone goes in and does it, you send that out to their primary physician, and then they can discuss the results there?
Yes.
Okay.
And is there a phone number that leads directly to the imaging center that you might want to mention, Alicia?
My number to the mammography suite is 435-713-9774. So if you have any questions, you can contact me there. Or the number to schedule, if you want to schedule your annual mammogram, is 435-713-1333.
Oh, fantastic. Yeah. Now, if someone is hearing this and they're like, oh, I need to get in and do this, like, is there a big wait time to get that scheduled and get you in, or can you get them in pretty quick?
We can get them in pretty quick. We have a lot of availability, and we also will accept walk-in patients. So if you're in the area and you think about having a mammogram because you see all the pink in the community, come on in, and there might be a short wait, but we can fit you in.
Oh, fantastic. That's awesome. So how long have you been doing this?
I've been doing mammograms for about 18 years.
Oh, wow. So you're skilled. You know what you're doing.
I do know what I'm doing, and a lot of women forget. And that's a good thing, to forget what you did last time, but I will remind you. So if you come in and you're nervous about it, not a big deal. I can walk you through it.
Okay. It sounds like it's not so... It sounds a lot easier than a colonoscopy that Blake was saying.
I think it is a lot easier than a colonoscopy. It has changed a lot over the years, too. I think the technology has gotten a lot better. It's not painful. It might be a little bit uncomfortable, and the whole procedure only takes about 15 minutes.
Oh, really? So it's really quick then. Fantastic.
Yeah. Shall we, Alicia, is there anything that we haven't asked you that you think our listeners might need to know? Because if not, I think we're going to hop on to the next guest we have here.
The only thing I can think of is in October, we are giving away a free gift for anyone who comes in. So we have lots of appointments left in October, so come on in.
Oh, that's fantastic.
Perfect. Thank you. Well, shall we hop on to Chandler Squire? Am I saying this correctly?
Yes, you are.
And you are a physical therapist at Cache Valley Hospital?
I am. I'm the physical therapist at Cache Valley Hospital, and our team for our rehabilitation and physical medicine team, we have also occupational therapy and speech-language pathology, or speech therapists. To kind of piggyback off of the Breast Cancer Awareness Month, our occupational therapist is also a certified lymphedema specialist. And what that person is someone who is able to perform massage techniques to help in draining the excess fluid that the lymph vessels aren't able to collect because of damage from procedures and or cancers.
Okay, and what are some of the instances? So this happens because someone's had surgery, and how does that manifest? Sorry, I'm a total layman. I'm not a medical person. Is this bumps on the body, or how do?
Yeah, so this would manifest as kind of a unique swelling in an arm if it was associated with breast cancer removal from surgery, or even in surgery from a leg surgery, a knee surgery, or an ankle surgery. That system that kind of collects that fluid and brings it back up to filter out can be damaged. And so the system is very fragile, and in some people it repairs very well, and in others it doesn't.
And so they can massage that out of there?
They can, and then for maintenance, they'll need some form of compression garment or some form of prolonged way to manage that, whether it's some different kind of compression therapies or compression garments.
That's fantastic. Okay.
Perfect. We're already coming up on our second break here, but maybe this is Chandler. Do you also have a different phone number than the hospital where people could reach you?
We do. Our phone number to reach us in our physical therapy and occupational therapy and speech therapy department is 435-753-1844.
Super, thank you. Yeah, we're touching on a lot of different specialities in the former specialty hospital in Cache Valley Hospital here in Logan. We're coming to our second break here. This is the Senior Moments Show. So again, stay tuned. We've got more for you. We'll be right back.
Reed's Pharmacy in Hiram offers free delivery service 5 days a week, Monday through Friday throughout the valley. Just stay home and they will deliver to you. With 25 different suppliers, they won't have the shortage that others might have. Also, with compounding and many other services, they will be able to serve all your needs. In order to stay safe and help slow the spread, please call Reed's Pharmacy in Hiram at 245-DRUG, and they will take care of you.
You have a lot of options when it comes to buying or selling a home. Do you list it online, sell it yourself, or do you have a realtor help? It's a major financial and emotional decision. A realtor is the liaison between buyers and sellers and really helps you navigate complex contracts, deadlines, and disclosures.
Hi, this is Sid Roeder with Achievement Realty. I work for you to get the best outcome for your situation. Let me earn your trust with a free consultation and a free market analysis. Call me today at 512-6406. Then list it, sell it, and move on.
This is Brian Erickson for the Sunshine Minute. Each day, our nurses, CNAs, cooks and servers, housekeepers, laundry staff, music, recreation therapy teams, office staff, receptionists, and many more arrive around the clock. These heroes show up ready and willing to serve and protect our residents and clients. We are so grateful to our dedicated team. On behalf of the Board of Sunshine Terrace Foundation and our community, thank you to all of our employees for keeping us safe. We bring more to life together.
Welcome back, everyone, to our Senior Moment Show. We've been speaking with Blake and his staff at the Cache Valley Hospital. Chandler Squire was just telling us about his occupational therapy and speech therapy, physical therapy, what they had going on. Chandler, besides the occupational therapy, or what else do you guys do?
Yeah, so as beyond the occupational therapy, we also have a speech therapist who help with the element of speech as well as swallowing, and they also actually perform cognitive or memory training. So as sometimes those are things that aren't really thought of as a therapy, but that is an element within the speech therapist's role, is to assist in assessing that and helping people find ways to improve.
That's awesome. So how would somebody get started down that realm?
Yeah, so identifying, especially with swallowing, I think is probably the one that would catch the listeners the most that might be hearing this, is a liquid or something may just not be suitable for swallowing, and it ends up going down that wrong pipe. And so having someone that's specialized to really look at that, with some help from the imaging center to really better identify, people that are at risk at swallowing things down the wrong pipe, and maybe they need to have that liquid thickened or some other tricks to make it so that all goes well with that part of their body.
So that's a lot of times drinking, it sounds like.
Drinking and sometimes eating.
Is it?
Yeah.
And then if they just notice this is happening more and more frequently, they can just give you guys a call and get something set up?
Yes, so that type of imaging would definitely come through their physician, helping to orient that so that there's good, continuation of care, and that information's being, shared well with the patient and the physician, and that a good plan is come to.
Awesome.
So maybe let me ask a question, Chandler, because I know that when I came here, I wasn't quite clear occupational therapy, what exactly that entails.
Yeah, so occupational therapy, to simplify it, they perform fine motor task orientation kind of exercise. So a lot of things that you can do with your hands and fingers. But additionally, they do assist in, some other exercises and treatment of injuries to the shoulder, elbow, wrist, and hand. And we're really lucky to have someone who specializes additionally in this lymphedema system and kind of this point of swelling that can happen. And she has some very close ties with family members that have had cancer and that have required those services, that have really pushed her into specializing in that. And we work closely with our wound care center and our imaging center to facilitate those kind of treatments for those patients, so whether they have those weeping legs or wounds that are just also maybe present from too much swelling, putting pressure on the skin and opening the skin. As much as we want to have that closed, it also requires us to help in reducing that pressure of fluid pushing out against the skin.
So it sounds to me like you got a pretty good team to collaborate to optimize the client care here, really, because you cross-refer in-house, correct?
Exactly, and we have the ability to discuss cases with one another and really pick on each other's expertise and specialty so that people are getting the optimal care.
Bryson, do you have another question that I didn't think of?
No, I was just thinking, so we talked about speech therapy and occupational therapy. What about physical therapy? That's your realm of expertise.
So physical therapy is my realm and expertise. In fact, my doctorate research was on how the legs move in postmenopausal women, believe it or not. So that's what my doctorate research was highlighting. And I'd say one of the things that our office offers uniquely is that we offer that one-on-one care. So when you're scheduled with our physical therapy department, you're seeing the therapist for that 45 minutes to an hour. Additionally, my office is located inside of the Sports Academy and Racket Club, where we also offer group aquatic therapy sessions, which is a great way for people who haven't really been active, that need to get more active, can become more active without as much pain and soreness, because that water alleviates so much body weight and pressure off of the joints that we're able to initiate people into exercise programs and help reduce those pains and get people stronger in a very, very nice manner.
Oh, that's awesome. With the swim class, I'm going to call it a swim class because that's just how I operate, but do they need a doctor referral for that?
We do. We require doctor referrals so that we can help process that through insurance and not get any surprises for patients, and insurance is not covering their therapies. So short answer is yes, for that reason. We don't want to surprise any patients with any surprise billing situations.
Yeah, you're just looking out for people. That's awesome.
So, but if somebody from the outside wanted to come in and join and be a cash pay, is that a possibility with that class? If somebody's listening and just thinking, I'd love to join that just to get fitter?
It is. It is definitely an option to participate in that cash pay component. Yes.
Awesome. We're already at the end of our show here, but I do want to have somebody take the opportunity to mention again your location and a phone number for Cache Valley Hospital.
So I'll just go ahead. This is Blake wrapping up real quick. We're just grateful to be here. Just want to educate the community about the services we offer. Again, we still think, we're special, although we're not a specialty hospital anymore. But more importantly, I think we want to treat all of our patients like they're special, because everyone is. And so just to remind you, we're up on 2380 North, 400 East, so just adjacent to Greenville Elementary. And I think rather than a phone number, the best thing you can do also is if you have access to a computer, if you need to look at our services, find a physician, just go to our website, look that up there, and that'll direct you where you need to go to each of the services. All the phone numbers, everything are there.
Okay, thank you, Blake. This is the Senior Moment Show. We'll hope you tune in again next week.